sure that you're getting people that are here to be healthy, because ultimately you and I, as consumers, taxpayers, pay for it.
Absolutely. Well, I have to admit, they do, in these inner city schools, they do have dental and everything covered. So that's huge. And that's huge. I was very surprised when I saw that. It was like, wow, that's a great step, of service to the children, of these generations. So thank you.
It's really a difficult predicament, because you've got a political policy, like I said, over immigration. Then you've got a health policy, which is you don't turn people away because they've got a nasty cough and they're coughing and coughing, and yet you turn them away because they're here illegally. And what you've just done is turn away somebody with active tuberculosis.
There you go. Yes.
So you have to look at that in that limelight and deal with it.
We did have a comment that came in, which was a very positive one. Yes, the California website is very easy to use when it is up and running.
Yeah, it's a fair criticism, I think. We laughed because we always said, what they should have done, and what they should, and we said this months ago, is contract with Netflix or Amazon, because those people, I don't know what I'd do without Amazon or Netflix. But yeah, I think it's clearly, I think anything like this, which is a massive technical undertaking, it's going to have its glitches. I would just encourage people to keep trying. There's also a 1-800 number on their website. Call into there, be patient. They only hired the people that are working in these call centers probably a month and a half or so ago. They started the hiring. It requires background checks. It requires fingerprinting to work in these, because they're dealing with confidential information, and you don't want people stealing that information. So be patient. I completely agree. The Covered California website has had some problems. It's doing better than the healthcare.gov website that the feds have, but they both have some improvements to make on that.
Thank you.
We need Segovia working for the government to fix it.
I'll tell you, Netflix is, here's your health policy, and what movie do you want for the next couple of weeks?
There you go. That would be Segovia's direction, yes.
We're speaking with Michael Harris, Director of Government Affairs at CenCal Health. And Michael, you've always been involved in public health policy to protect and serve the public. So even as an administrator, I'm sure that you have a health tip for us.
I do. I think, even today, there's a new study out that says sedentary life. So if you're somebody like us that gets up early in the morning, goes to the gym on the way to the office, or goes to the gym after work, the fact that we sit behind desks, the fact that we've become very sedentary,